Hey, cool cats and kittens. It's me, Dr. Landwermeyer here. I'm at St. David's South House Medical Center, and I wanted to give you some coronavirus updates. It's time for another one of those. So we've got a lot of questions that have been coming in about the goings on at the hospital. So I wanted to let you know that we are still allowing your support person to come with you in labor, and there's no thought to stopping that at any point. So you can count on the fact that you will be able to have somebody with you there in labor. Of course, we're not going to let anybody in that has a fever, and everybody that comes through the doors will be checked for temperature. Obviously, if you as the pregnant patient are sick with a fever, we will take care of you, but we aren't going to let the support person come in if they have a fever. In addition, we are still able to do all of the procedures that we need to do, including inductions of labor, taking care of spontaneous labor, and scheduled C-sections. We're still at this time not able to do any type of elective GYN surgeries. Only emergent surgeries can be undertaken at this time. The hospital is still offering circumcisions to patients who choose to have their son circumcised while they're here. In addition, we're changing some things at the hospital, and it could start as early as next week. We're going to start testing each patient for COVID-19 as they come to the hospital, because the data has been coming out that there are a lot of patients that are asymptomatic and carrying the virus. We want to identify those patients for their safety and for the provider safety as well. Along those lines, I've got some good news for you guys. A new study has just come out that was done in the New York area, where they've really been an epicenter for the COVID-19 virus. And so this study was done with New York's Presbyterian Hospital and Columbia University. And they talked about 43 of their patients that they tested that were positive for COVID-19. And out of these 43 patients, they really had an overall favorable outcome for all of the patients. They only had one patient out of all 43 that even required extra respiratory support or any type of extra medical care. And out of those 43 pregnant patients, there was zero transmission of the COVID-19 virus to their babies. So this really made us feel a lot better about how things are going for pregnant patients. Now, don't take this as a license to go out and party and go to HCOBGYN and do all your shopping and everything. We still need to continue all of our precautions, but along those lines, our precautions are working. And a lot of the new modeling is showing that the curve is starting to flatten a little bit. We just really need to keep this going for probably another 4 to 6 weeks to keep this virus from spreading to each other here in our Austin community. And we're doing a really good job, so I just want to reassure everybody and let you know to keep it up. Some of the things that are going on at the office, we really want to continue to kind of limit our interactions at the office. We're here for you, and we're happy to see you whenever. But if your annual exam could wait a couple of months, maybe give us a call and let's reschedule that, and we can refill your prescriptions for you, and then we'll reschedule your annual exam for like 3 months down the road. We're also able to do a lot of our visits by telemedicine. So according to the new PAP guidelines, if you don't need a PAP smear, or if you don't feel like you need a physical exam, just give us a call and schedule a telemedicine visit. We're happy to do that. We can also do telemedicine visits with the OB clientele that we have, and we're happy to do that as well. If you're not comfortable with doing a telemedicine visit and you really want to hear the baby's heartbeat, you're welcome to do that. If you want to hear the baby's heartbeat, but maybe you don't want to come into the office, call us and we can offer you a drive-through service. We'll come out to your vehicle, we'll have our masks on and shields, and we can listen to the baby's heartbeat, do your blood pressure and everything, and take care of you in that way. We are asking that if you do come to the office, if you could bring your own mask, either a cotton mask that you've made, or if you have a mask there, that would really help us out, since the new guidelines from the CDC are that everybody should be wearing masks in public now. With the telemedicine visits, if you have your own blood pressure cuff at home and you're either talented enough to take your own blood pressure, or if you can get a family member to take your blood pressure, that would be really helpful for us with the OB visits. I wanted to let you know also here at the hospital, I'm at the back of the hospital where we're asking all of our patients to arrive. There are two entrances to the hospital. There's the main entrance that's going to be on this side over here, and over here is the ER entrance. We want you guys to come into the main entrance. We are doing temperature checks on everybody here at the main entrance, but this will keep you separated from the people that need to come into the emergency room that may have coronavirus and may be actively seeking medical care for that. So you can feel safe coming to the hospital here and having the two entrances. And I want you to know that we're still offering the valet parking. So if you need the valet, just pull on up here to the back of the hospital and we're glad to do it. But parking has not been an issue at all in a few weeks. Please feel free to call our office if you have any questions. And as always, stay safe, be well, and wash your hands. Have a great day.